And so we are likely to see different modes showing up. And the person who we're seeing feels he or she's going crazy, losing control. Therefore, it's important to do mode tracking to help the person to identify what he or she's going through. And that in itself is going to be very, very, very helpful. And you know how to do this with your training schema therapy. So this is, you can see the slides later on. These are the conceptualization of this patient. So the therapeutic relationship is definitely crucial. When I work with a man who ran over a young man who was in an emergent country where he was working, he sought help because he was having these intrusive, overwhelming thoughts. And basically what he thought is, I'm a murderer, Patricia, this is it. My life is over. And so we worked a lot with the empathic confrontation, and I could say to him things such as, I can understand you think you are a murderer and that your life is over. However, what happened was a tragic accident, and you can still have a good life. It took some sessions. I saw this person 4 times a week during the first 2 weeks because he was having severe clinical depression, and he was alone. That was in New York City. But the good news is that he did not have PTSD. He met criteria for acute stress disorder and had the short-term PTSD. You know, it shows up the diagnosis after 1 month. And but fortunately, he recovered. He did not meet criteria for PTSD 6 months down the road, according to the Davison trauma scale that I used at that point. So needs can be very practical. That's very important. And the reason I have this image is because this illustrates a man who was being seen by an Ukrainian therapist, and he was obsessively doing video games. And these video games, were associated with this detached protector mode, and this detached protector mode was adaptive, and it was adapted in the beginning, but it was not adapted down the road because he could not, for instance, go to a shelter when the shelter was needed. So how can we call this mode? I'm checking the time because I want to make sure that we have enough time for the videos. Okay. This mode, we are not going to talk about little John, little Oksana, no. We are going, or little you, okay, or even vulnerable child mode, not so much, but I prefer to talk about the emotional side, your emotional side, which, by the way, in my experience at least, is much more accepted by men, who do not like so much, especially narcissistic men, the name little Paul, little you. So again, we're going to be paying attention to safety, self-disclosure. We talked about this. You may need to modify an existing case conceptualization. For instance, I have a patient who has an avoidant personality disorder, and her main emotional need that has been unmet was or still is empathy. Okay, so I needed to emphasize on empathy, on understanding her, giving her emotional understanding. But when she had a near death life experience with an accident that her parents had, I had to change the conceptualization. Use of transitional objects, yes, for sure. That's very important because finally, we're strangers to these people who come with acute crisis. We are strangers because they don't know us. Maybe they will never see us again. Maybe like what happened with the supervisee, Ukrainian supervisee, she had somebody who stopped at her city and then moved to Western Ukraine. So basically, there was no time, much time to work. Therefore, transitional objects like a family picture could be very, very important. Compassionate imagery from compassion-focused psychotherapy can work as well. However, we need to be careful because what we can see is the activation of a punitive critic, for instance, demanding critic. And you will see that in the video.